The Minister of Health, Riina Sikkut. Hello, everyone. I'm very sorry. I would have really liked to participate in the entire conference, but today is a busy day in the government, so I can only give you a brief speech today. But I'm still really happy to be here, and I'm very glad to see that you have made a lot of effort to make this accessible. My task here is to give you the government's view, but I think that government is not separate from an individual. So when we speak about different amendments or different ways of financing something or supporting something, I think it's important to have a common understanding that a rare disease or a disability isn't anybody's guilt. It's not anybody's punishment or suffering. Nobody has chosen to be like this. But this has happened. This is the situation. And in a case like this, we can find solutions only when we work together. By working together, I mean a very broad view. And now, from the government's perspective, the first thing is cooperation on the European Union level. We don't manufacture pharmaceuticals. Therefore, it's very important for us how the launching to the pharmaceuticals on the market is regulated in the European Union and how the market motivates research and development in order to find medicines for rare diseases, to give them market access on easier terms, to spread information about clinical trials and efficacy so that all decision makers could have this information at hand. And I know that it looks like a lot of bureaucracy, but actually the last list of reimbursed medicines on the European level was very positive. Usually it's very difficult to protect our interests there, but this time the patient's view and small market view had been taken into account. They want to have regulative protection on the market, and they want to direct more investments into R&D, both in the field of orphan drugs. So it's important for the European law to support the accessibility of orphan drugs. The next thing I'd like to speak about, the government decided last year that we'll change the Health Insurance Act and we will simplify the rules to add orphan drugs on the reimbursed medicines list. That would allow the Health Insurance Fund to make decisions more easily and based on different criteria than with other diseases. We are preparing this amendment this year. It will be proceeded next year. And this is when the everyday practice could change. So starting from next year, in the last year, the state supported the children with rare diseases with 800,000 euros. Then now we have decided for the next 5 years we have increased this amount, so it will be 5 million euros for next 4 years. But of course, we should also support adults with rare diseases. And the last thing, cooperation between different parties who support people with rare diseases. It can be local municipality or therapists different organization of representatives, for example, the Estonian Chamber of People with Disabilities, they all have to cooperate. When a state decides something, there are specific criteria, specific conditions. And although we do want to be patient-centered, we do have to set some rules and a framework. With every single decision and rule, there is somebody who is out of this framework. This doesn't mean that this person will not receive help, but we have to find alternative ways of helping them. The needs of every single person with a rare disease are different. When we speak about being patient-centered, we should take a person's own preferences into account. We might say that we need to do this and this, but maybe to improve this particular person's quality of life, we have to do something extra. It might not be evidence-proved. It might not be a drug financed by the health insurance fund. But it still might be something that this person needs. We have to work together to come up with the best solutions for people and their families. Today we have a very long working day in the government, so I will not be able to participate in the roundtable discussion. But if you have any questions, then I will be very happy to answer them here and now. Thank you. So, questions for the minister. This is not an everyday opportunity. So, if you have a question, please raise your hand. We'll give you the microphone. No need to be afraid. Okay, there's a hand. Hello, and thank you. My question would be, how do we divide these 5 million euros? The conditions of this support measure, I have seen them, and the round of applications will be opened soon, but since the amount is bigger than the one we had last year, then the Minister of Social Affairs will include all the organizations that we have supported in the previous year, so they might be connected to transportation, different types of therapies, support of the cost of medicines. So we would like to give all organizations the amount that they need. We support the organizations that are there already, that have provided support in the past. So you can't start a new company today to get the funding. And also we fund certain types of activities. But we have a bit more flexibility here. The health insurance fund has a certain rules, certain framework, but we have a bit more flexibility, so we can decide what kind of support particular people need. Thank you for being here today. My question is the following. I have read the bill about these 5 million euros, and my question would be, please tell me I'm wrong, but I hope that this 5 million euros, that you won't try to solve all the problems, or it might not solve all the problems, because our association didn't really or wasn't covered by this amount. And also, when children who with rare diseases have become adults now, but their treatment doesn't stop once they turn 18. So where's the solution? How can we support adults with rare diseases? Of course, we can't solve all problems with this 5 million euros, but this is a measure aimed at children with rare diseases and for people who have been diagnosed in childhood. So, with I think that the health insurance fund will be the organization that will mostly finance orphan drugs and services aimed at people with rare diseases. So this will be their task. And we will amend the law. We will this way a health insurance fund can make decisions more quickly when it comes to funding orphan drugs. Yes, 5 million euros is not a large amount of money, but this is more than we have contributed to health insurance funds contribution before. So I think that this will nevertheless improve the situation. I'm Matli Kadajas from the Estonian Cystic Fibrosis Association. There is a very effective treatment for our patients, but unfortunately, it's not reimbursed in Estonia. We have 5 patients whose health condition is more severe and who receive this treatment through different charitable organizations. And there are about 40 people requiring this treatment in Estonia. So my question would be, when will these 35 other patients receive this treatment that they actually need? I note that there are ongoing negotiations between the manufacturer and the health insurance fund. I would like to make this decision as a political decision because everybody wants to be popular, but unfortunately, this is not possible. The Minister of Health or the Minister of Finance don't decide which drugs will be reimbursed. It depends on the negotiations between the manufacturer and the health insurance fund. So when they find an agreeable price, then this medication will be available for the Estonian patients with cystic fibrosis. Coming back to these 5 million euros. You mentioned many different types of services that it would cover. Transportation, for example. This is the responsibility of municipalities. Today, the burden of lays on local municipalities. Shall we solve the problems of local municipalities from the government's perspective now? Maybe when we just divide this money to different parties, maybe we won't solve the actual problem that we have. As far as I know, local municipalities cannot apply funding from this 5 million euros. This is an extra support for people. This 5 millions is not meant to increase or to lap the budget of the local municipality. Since people have very different needs, then our aim is to support flexible support to children with rare diseases. And this involves supporting the work of the organizations who have been doing it so far. And we don't set a very strict cost limit. For example, if a child needs hippotherapy, then we can fund it because this is not funded by the health insurance fund. I think that this is a flexible measure that helps us cover different types of costs. So far, these costs haven't been covered by municipalities or by health insurance fund. If there are municipalities who have done it so far, this doesn't mean that we will do it for them. No, this 5 millions will definitely not go to support local governments. I don't know if it's a question, maybe a remark about this 5 millions.
ta pole ju veel ametlikul ringil, aga selles mõttes ma vist räägin väga kõrva kellelegi, ma olen Siiriga tõesti väga nõus, et sealt tegelikult ei tule välja ainult see hobuteraapia juurde.
Agree with Siri that
need plaanid, mis riigil rehabilitatsioon
this is not about hippotherapy only.
läheb Tervisekassale, siis ma loodan väga, et ka hobuteraapia jõuab sinna.
When rehabilitation services will go to the responsibility of the health insurance fund, then yes, but when it comes to these 5 millions, then I saw that this was aimed to support the treatment of children with rare diseases and to continue their treatment once they reach adulthood. I don't really understand why we should pay for the services that should be provided by the local municipalities. When the state has given a responsibility for transportation or childcare services to the local municipalities, then we shouldn't cover these costs from this extra 5 millions. And I don't think that it's very reasonable to tell the service providers that, you can do whatever you want with the money, because we lack resources and it should be allocated with a very specific purpose. I don't know whether this was a question or not, but this was our initial feedback to the ministry. When you apply for money, then it's up to you to decide which costs you cover. When these are covered by the local municipality, then, of course, yes, this is their legal responsibility to provide certain services, and we assume that this is what they do. The organizations that apply this money, they are organizations that provide different types of services. They can also be services that are provided by the local government already, but we don't tell you that you can't provide the services provided by the municipality. Yes, but for example, when we fund childcare services from this 5 million, but also it's funded by the local municipality, then it doesn't sound reasonable, because actually we have a responsible party here and it should be the local government. I do agree, and in an ideal world, this would work, and I really wish we lived in an ideal world. But when we have a local municipality who hasn't funded the childcare services for a child with rare disease, then it's up to you to decide whether you want to cover this cost from this extra money that you can apply for from us. So we have this political decision to allocate this 5 million euros. And this is because we know we don't live in an ideal world. So this 5 million gives us flexibility to solve problems we have. Your organization doesn't have an obligation to cover costs that local municipalities don't, but if you want to, you can. From the Children's Fund perspective, I can say that we will not fund therapies and transportation. We think that this is the duty of the local municipality. We always ask for their help. And we work to assure that local governments would contribute, because otherwise we have worked for nothing, because municipalities will come to us and say, but you have money, so you can use this to fund these services. I think that our critical need today is to finance expensive orphan medicines. I do hope and think that we should contribute this 5 million euros to solve the most critical problem. all these other things can be funded by local governments, municipalities. Some parents can afford this as well because actually, usually families with children with rare diseases are families who are not very poor, so they can manage. So I think that we should use this 5 million to solve the most critical problem. Exactly, and this is a decision that you have to make.
Ma tahtsingi täpsustada, et
I
seda
wanted to
raha
specify
taotleda saavad ja
who can apply
arvestada
for this
sellega,
money,
et on oht, et hakatakse ütlema, et näe, raha
and
kogutakse
maybe
siin, võtke sealt, miks te
there
meie
is this
juurde tulite.
danger of people saying, the money is there. Why did you come to us? So maybe the local municipalities will say that. Yes, I do agree. We do have municipalities who don't abide by law, who don't provide the social care service that they should be providing. And when we have a situation where a local municipality doesn't complete their responsibilities, then we have to deal with it. The cases that we have seen mostly involve irresponsible municipalities. And if they fail to do it, if they fail to help people who are in need, then we have to take this case to courts and to the media. These 5 millions are not aimed at alleviating the situation of municipalities. But we are not going to restrict it. You can allocate this money to whichever end you want. All these different organizations that have provided support services so far are the ones that can apply for this money. And one last question. Thank you. Your previous answer, maybe I was very unclear, but in our case, the problem is a combination of medicine and medical food. And I got the idea that this 5 million is given to these different funds and support organizations. I think that medical food also qualifies. Yes, these are children who have received special powders and from the health insurance fund, but at the same time they have had to buy expensive food items that are specially designated for them from special shops. These people who have this disease used to be unable to work, but nowadays with a proper diet, they can manage with their lives. So I think that this 5 million still doesn't solve our problem, and we feel that we are left out. I understand that this is a very specific problem, but I just wanted to explain or express our concern. Yes, I am not a lawyer, so I am not sure whether you can apply for this support measure. So when the problem started in childhood and the person is now an adult, then we can support them from this measure. But when the diagnosis was received in adulthood, then we cannot fund this treatment from these 5 million euros. I'm not a lawyer, so I'm not very sure, but this is my understanding. Thank you for a wonderful overview, and I am Raul Saare from 6BO Pharma.
see 5 miljoni teema on suurepärane, see on kindlasti nii-öelda suureks abiks hetkel.
It's wonderful that we have allocated this 5 million euros.
Igal aastal suurepärane. Et tundub, et see on
So it's 5 million per year.
kindlasti on abiks.
And I'm sure that it will be helpful. But have the politicians thought about a more sustainable solution, considering that the health insurance fund has done its best to use the 30% social tax being used in an optimum manner? About a year ago, we were discussing taxes, so maybe we should also think about increasing the social tax. I think that many people would be willing to contribute more through social tax because the treatment queues are long. We didn't really discuss increasing the social tax. It might sound weird, but I don't really care where the money comes from, but we do need more money. It seems that we need to find an alternative way to increase the funds of the health insurance fund. It doesn't have to be social tax, it can be car tax or some sort of excise duty, so it doesn't matter. But we have a shortage of 150 million for next year, and we can't really have shorter treatment queues or more reimbursed drugs when we don't have increased funds. The general financial framework affects our ability to improve treatment for patients. Looking at contribution from other countries, then when we have contributed €1 to our healthcare during this 32 years that we have been independent, while other countries have contributed €1.5. So over a long time period, this makes a difference. When we look into the future, we need a lot of extra financing. We should need about €400 million. This is about 1% of our GDP, but probably it will be more. I can't see the social tax being raised in near future, but when the situation of the health insurance fund is very critical at some point, then we will have to find additional financing. At some point, we will have to invest more in healthcare and social care, because otherwise we will have a second-rate medicine and second-rate citizens. And this is something that I don't think we want. My question, what do you think, how effective is the process of adding medicines to the list of reimbursed medicines? This whole procedure is hindered by negotiations. Should there be a brilliant negotiator so that they would find the perfect price? Or maybe in the European Union, there could be a different pricing policy where certain medicine could be offered at a better price than in other states. Thank you for the question. This is a whole different discussion. It's very difficult to say anything about the price levels or the success level of our negotiations of Estonia. It's very difficult to compare prices on an international level. I have tried to compare the price of cardiology medicines in Europe, and it's very, very difficult to get a clear picture. When we look at the general health figures, then in cardiovascular diseases, we have decreased our mortality the most. We have been very successful. For many common health issues, we do have very we have medicines at a very competitive prices. When it comes to new medicines and orphan drugs as well, it can be difficult. And it all comes down to the life and health of one or two specific people. So there, the situation might be different. But I think that at the moment, considering our budget and the market, I think that we are doing our best. And I cannot say that our patients would be in a very disfavorable position. Thank you. Thank you. I think we have to move on here. Thank you, Minister. A round of applause.